Coming up next on WVOX, licensed insurance agent and Medicare specialist Mark Brownstein hosts his monthly educational segment, Medicare Mark on the Air. Tune in for guidance, special guest interviews, and valuable information on all things Medicare.
Good afternoon, WVOX listeners. This is Mark Brownstein again. On a wonderful Monday morning, I'm here with a very special guest, Brenda Moynihan. Again, Mark Brownstein, what we do is Medicare. We help people all day long. We actually just had a wonderful client appreciation event yesterday for 150 people. We love our clients. We love our staff. We love what we do. We know that people value what we do. And any questions you have, please don't hesitate to reach out. 845-358-1220. Look at us on the web, emeraldmedicare.com. Brenda, welcome back to WVOX.
Thank you. You
used to have your own show.
I did. A couple of years ago. I sure did.
Yes. So some of the listeners may actually recognize you. So Brenda and I know each other, folks, from a number of organizations. Orion is an organization that really supports seniors in many ways. There's so many different kinds of professionals that are supporting seniors, and this is just sort of a collaboration of people who get together and talk about the industry issues and really learn from each other. We're also part of an organization called Northern Westchester and Central Westchester Geriatric Association that has case managers. So again, the subjects that I talk about, that I bring guests on every month, is really about senior living. And in your case, Brenda, first of all, you're from this Westchester area, are you not?
I'm a Yonkers girl, born and bred.
All right. Well, that sounds like a lot of pride in that.
Sure is.
Yeah. So in Yonkers, and went to school at Manhattan College.
Yes, that's correct.
And then how has your career sort of evolved in schooling, and where were you educated?
Well, I got a BS in psychology, which if you're a psych major, you understand people, let's put it that way. And, I went into health and wellness, and from there I worked with different populations, from children to teens to seniors. And I loved working with the seniors. And it was a natural progression. Over 20 years ago, one of my friends said, hey, there's this thing called assisted living. They're looking for an activities director. And I just fell into it, and I've been in it ever since.
So activities director. Activities director is one component, but it's also marketing. It's about outreach.
Exactly.
It's about having people understand the type of facility. And you've been at this at the Kensington for 12 years.
Yeah, 12 and a half.
12, that's a long time at the facility.
Of. Yes, absolutely.
And so you know a lot of the community. You know a lot of the professionals. You get referrals from all sources. But the facility that you have is unique.
Yes.
And it's unique in many ways. And again, these are people who are at all levels of need of care, or are there specific levels of care that you would tend to gravitate to and feel like you support the strongest?
That's a good question. We're actually a medical model. We're very unique. I believe there are something like 17 or 20 assisted livings that have the same license that we do, an enhanced assisted living license, but we use it to the fullest. What we do, no one else does. So, for example, we can take care of very frail people who need intermittent feeding tubes, any stage wound, IVs, catheters, and much, much more. So the physically frail and also cognitively, people with dementia, Alzheimer's, frontal lobe dementia, Lewy body dementia, dementia and behaviors. We can successfully take care of those folks. So I say that we're unique because we take the frailest of the frail.
Well, that is a huge statement in a community and a region that has a tremendous number of facilities that we're speaking of, and people change over time, right? And so their condition changes over time. Right. So at what point do you generally have them come to your facility? Are they at the frailest of points, or are they at a point where the family feels like it might get to that point, or they just want the beauty of your facility? Right.
I mean, we are beautiful. I would say all of the assisted livings in the area, they're beautiful. Yeah. Warm colors, beautiful furnishings. We're unique. We can take folks from the get-go that are very frail. So if you're mom or dad, or you have a loved one that has end-stage dementia, we can take that person, they can live with us, and we can take care of them. Or someone with a movement disorder. So, for example, someone that has Parkinson's or MS, ALS, they may be in remission, especially with MS or Parkinson's, but their family, they know that, excuse me, this is a progressive disease. It's not going to get better. So either they know that, hey, let's get mom or dad somewhere now, or they've had 24/7 care at home. That's just not really cutting it anymore. So we would get that person. They would come live with us.
So 24/7 care is certainly the extreme.
Yes, absolutely.
And, coverages like Medicare and Medicaid just don't handle that. Mm-hmm. There are some rare situations where Medicaid may have a fairly lengthy day attached to care. But at some point, some other model needs to be considered by the family.
Right. I mean, it's not a simple decision.
Right.
And it's not to say that home care is bad or the other assisted livings are bad. It's just different. Right. So we're just a different model. As I said, I don't want to bash anyone else. Right. It's just different. And I think there's a time and place for other assisted livings, and there's a time and place for 24/7 care at home.
So I think one of the biggest indications of how successful your model is by, well, I guess you can tell us how many beds you have or how many rooms you have, but how full it is.
Sure. So in the world of senior living in Westchester County, we have 87 apartments, and that's moderate. Not really big, not really small. It's a moderate number. We average approximately 97% occupancy, which is pretty good. That means that's 97% full. We usually don't have a lot of availability. I think because the need is so strong and because of what we do is so unique to our building.
So, you've been doing this for 12 years, and again, you're dealing with the frailest of frail and the parents or the adult children or
right.
family members. And so these are difficult decisions, as you
Absolutely.
said earlier. And so it seems like this is fulfilling to you. What makes this so fulfilling to you as a career and as something that you do with such passion?
It's a really good question. I think because we're helping people. I'm also an adult child. And if you think of it's guilt and fear, the guilt and fear of placing mom or dad in assisted living, having that caregiver at home or into a nursing home. You feel guilty and you're afraid, is everything going to work out? Are they going to take care of mom or dad? Where at the Kensington, I know that we do a great job. We do an excellent job in reference to care. So that feeds my soul. And then there's the marketing piece. I get to be creative. I love to do different things, different events, hosting different types of events, and just being able to get to people and letting them know that we exist and what we do is so unique and special.
So the adult children, like yourself, you have a 91-year-old mom?
Mom, yes.
Right, that you're, where is she?
At home, caring, yeah.
She's at home. Mm-hmm. So you've seen it, you've lived it,
yes.
You've experienced it, and so you understand what the adult children is really going through. And in some cases, they're remote. They don't live in the area, but
That's
they
right.
found this facility. And and so how does that tend to work? What level of communication are you involved in terms of communicating, the overall health of their parents?
I think, we have people that are local, the adult children. They come and visit the residents on a regular basis. But as you said, those that are not local, many times they hire a geriatric care manager that kind of assists them in thinking about what's the best place, what's the best thing for mom or dad. And then they come to the Kensington. So there's that communication of phone calls, there's Zoom, there's Slack, there's photos, there's emails. We're in constant communication with the families. We have newsletters, so they know what's going on in the building. Photos, look, there's mom doing an activity. Mom didn't eat all of her breakfast today. Constant communication, I think that's very important, and I think we do a really good job of it.
So the people that are coming to the facility, are they local folks or
Good question.
Connecticut, Westchester, New Jersey? Again, there's an abundance of facilities, but yours is unique, and you're 97% full. That's a tremendous number in the world of facilities. There are places that are 50, 60% full.
Right.
And so there's obviously a lot of competition out there. But are people coming from fairly far and wide or fairly local?
That's a good question. Most of our people are coming from the White Plains area. We're located in White Plains. Yeah. That's pretty standard in the senior living world. Wherever the building is located, your number one city where people are coming from is the city where the building is located. But I would say mostly Westchester, but we're really all over the country. Right. You know, if you think about the children live all over. And if mom or dad lived locally, they want mom to continue to live locally. So we really get people from all over the country.
And is this a model that's duplicated in other parts of the country?
Yes and no. So we actually, my parent is Kensington Senior Living. We have 7 properties right now, including my property, the one in White Plains. In California, we have several in California. They use the license to the fullest in that particular state. So that's why I say yes or no. In California, they can't do feeding tubes. They can't accept people with feeding tubes. But they'll use that license in California to accept the frailest person that the license allows. In reference to what we do in White Plains, there is no other senior living that does what we do, taking that really frail level of senior, that high acuity.
So with that all said, Brenda, by the way, Brenda Moynihan, tell us how they get a hold of you, Brenda.
Sure. So folks, if you need information, please feel free to call my building. The number is 914-390-0080, or please go to our website. We have wonderful events at www.thekensingtonwhiteplains.com.
Great. It's so important to people, I think, to understand the difference between facilities and the fact that this model isn't really that readily duplicatable. And even though many facilities tout their license, they're not really using it to the extent that you are.
Right, and that's their
an interesting model.
And there's nothing wrong with that. That's their model. They choose not to use it the way that we do, which is fine. So you really have to think about your mom, your dad, your loved one. What's the best location for them? And think about the conditions, the comorbidities that they're experiencing. What would be the best place for them to take care of them?
So some of your networking is actually with other people that do the same kind of work that you do at other facilities.
Absolutely.
Because they need to know where they can put someone who needs the kind of care that you provide.
Mm-hmm. I mean, we have great relationships with all the assisted livings. I think because we know someone who's very independent, for example, the 80-year-old who drives, uses a cane, has friends and family. That's not my typical resident, and I'm able to refer that person out to another property, another building, who really would be better suited for that person, that more independent person. Vice versa, those other senior livings, if they get a very compromised person, they know that either their model is such that they can't take care of that person properly, or the person has lived there for a while and they're now getting to the point where they can't take care of them. They then refer to the Kensington.
Well, again, that's the way the world of business should work.
Oh, yes.
Is that, people know what each other's niches are, skill sets are, strengths are, and freely refer. It's not like people aren't getting older every day, and impairments just simply come as a natural event of getting older. And so we all see it, and we all know stories of people who want to be home, and who can't be home, and there's maybe they're in a 3-story walk-up or whatever the situation is, and of course it's still about cost, but there's still a matter of trying to make sure they're in the right facility and live their life out in grace and with integrity.
Right. I think most people want to stay at home. We all know that. Yes. I would think the same thing, right? But there are times when home is no longer the safest and the best option, and you hit it right at the nail on the head, Mark. If you're in a 3-story walk-up and it's not ADA compliant and you can't get around, that's probably not the best option for someone who is now aging and they're now in a wheelchair, et cetera, et cetera. So you've got to think about those options.
So of the marketing that you do, Brenda, Is it to the other professionals in the industry? Is it to consumers and adult children? How do people sort of hear you speak? Again, you used to be on the radio show. You have your own podcast. So you are always educating like I am. And so where is the forums in which you educate?
So I educate both the adult caregivers, the adult children, and the professionals. Through our website, all the things that we do, all of our events. I also speak at different locations. I don't just talk about the Kensington. When I do presentations, I talk about what's out there, what's independent living, what's assisted living, what's enhanced assisted living, what are the differences, what are the, how do you pay, so that the general public understands and they're better armed to make a decision for their loved one. So I think through all of those venues, that really educates people and also educates people about the Kensington.
So where would you actually speak to them? At a library, at your facility?
Everywhere. Libraries, senior centers. I've done presentations virtually in the city, virtually in the city. I do a little bit of everything. So if anybody wants somebody to present, I think because I've been in the industry so many years, I do know a lot about the industry, the differences, similarities, costs, and things like that. They can always contact me, and I'll very gladly do a presentation on senior living.
Again, Brenda Moynihan, 914-390-0080. A tremendous professional in an area that when the need is there, there's someone there who can explain to you not just the work that she does, but the industry in general. So I know that you're connected to the activities. And so, that's maybe the fun part and the part in which you get to see the seniors smile.
Right.
And,
so much
and
fun.
look back to their, whether it be music or I was just talking to someone the other day about knock hockey. I mean, just silly old things in our client appreciation. We had dominoes, we had pickup sticks, right? We had all these things for that seniors that we support in Medicare. But what are some of the activities that you do at the Kensington that people enjoy?
I'm not the activities director. We actually have an activities supervisor, Shami. She's fabulous, wonderful. She comes up with all these different ideas from senior prom. We have all these different themes on a weekly basis. She's got all the fun stuff, all of the different items that she brings out, like hula hoops, all kinds of fun stuff. And if you think about it, not only is it fun for the residents, for the seniors, it's fun for us too, for the team members, because we are interacting with those residents. So we have a lot of fun in the activities that we do.
So again, 87 rooms. Some of them are independent rooms, and some of them are shared.
Yes, you can take them either privately or shared. Of course, if you take them shared, it reduces the fees, which is important to some people.
Absolutely. So, when you think of the activities of daily living, right, it's certainly something that people hear about. And at some point, that's when the need for a facility like yours becomes even more prominent. So just mention a little bit about activities of daily living, and I think that would help the listeners.
So I think most people are familiar with ADLs, activities of daily living, which includes bathing, dressing, providing medication management. If you take it to the next step, again, think of the person that has comorbidities, perhaps someone in a wheelchair. They may have wounds. They may have CHF. They may have an IV, a catheter. Well, if you're the adult caregiver, if you're the adult child, the daughter, that's difficult to take care of at home, right? Especially you're taking care of your dad, you're addressing the catheter, whereas the Kensington Senior Living in general can take care of more of those ADLs, those extensive activities of daily living. We've got some residents who take 20 different medications a day, 20 different medications, which again, if you've got a loved one at home, that's a daunting task, right? To remember what meds, when to give them, how to give them. Whereas if you've got a loved one living in a community, it just makes it easier because you can go back to being the adult daughter, the adult son, right? And have the Kensington or some other senior living take care of mom or dad. I think that's important.
I think it is important because, to give and to be a caregiver is very different than just being a son or a daughter.
Right.
Just showing love and watching a ball game together or just doing some game. Yeah, it's a very different
stressful
role, and a parent doesn't necessarily want to have roles reversed.
Right, and that's a good point too. Does your parent want you to take care of them? I don't think so. I mean, it's more convenient, of course. They know you, they love you, but I don't know that they would want that. It's a good point.
Yeah. So the kind of staff that you must have has to be at a top notch.
Absolutely.
This is probably another defining component of the work that you do, or else you wouldn't be able to deliver based on the enhanced license that you have.
Exactly.
So just talk and tout a little bit about the staff that you have underneath you.
I mean, that's the crux of our business. Right. We've got, I believe, the highest number of care staff at all the senior livings, or one of the highest. We've got approximately 200 on our employees. Most of them are part of the care team. So if I look at the different ratios in the building, think about it. You have a mom or dad that's compromised. You want a lot of people caring for them, hands-on care. So we've got 3 different disciplines in the building. The assisted living portion, Connections, which is for folks with early to moderate Alzheimer's dementia. And then we've got Haven. Haven is really for folks with moderate to end-stage Alzheimer's dementia. On Haven, the care ratio is 1-4, meaning 1 caregiver for every 4 residents. I can tell you, folks, that number is a huge, huge number. I don't believe other assisted livings have that number. And if you think about it, 1-4, that's more touch time for your loved ones. And that's a true caregiver number. So that the activities people are not involved in the number, it's just caregivers. Connections is 1-5. In the assisted living part of the building, it's 1-7. That tells you that's a lot of care staff caring for those compromised residents.
That is really so incredible, those ratios. Again, you can even think about schools that help children and the ratios within that and the care and the attention that a child will get when they're not in a classroom of 20 and there's a classroom of 3 or 4. That kid learns better. And same thing with an adult who's needing the care, that touch point. And again, the family member can't be there all the time. And so if you have 7 to 10 people you're caring for, that's a lot of work. And some people will take up more time than others.
Right. And I mean, we have the nurses. We've got 5 nurses in the day in the building. That's unheard of. In the world of senior living, I think most senior livings have 1 nurse in the building. We've got 5. Again, if we're going to take care of that moderate to frailer population, we want to make sure we've got the clinical team to do that and support that.
Well, it sounds like you have incredible pride of not just what you do, but the facility that you work with. And again, so many people in the community. And, if somebody is listening here and has a parent, a loved one who's sort of being more challenged than they were maybe a week, a month, a year ago. What's your suggestion to them?
I would say do your homework. Go on the internet, look up different senior livings, whatever makes you feel comfortable. Most people want their mom or dad to be in the town that they live in. That's most people. What are the needs? Visit places, call up, make appointments, talk to the residents, talk to the family members. Make sure that particular assisted living can take care of mom or dad. You also want to ask specific questions. When would my mom or dad have to leave? That's a very telling question.
Why?
Because the other senior livings, even though they have the enhanced license, they'll be honest and they'll tell you, when mom gets to the point where she needs a feeding tube, she has to leave. Or when she has a stage 4 wound. Or could be when mom is wheelchair bound. Different senior livings will give a different answer, but it's a very important question so that ahead of time, can mom live there forever? Can mom, quote unquote, age in place? Or will mom or dad have to leave at a certain point?
So, again, I have dealt with that in the world that I was involved in with being an elder advocate, but I guess I'm curious from your point of view, what happens if they have a situation like that where the person needs to leave? They've got their friends, they've got their home, all their stuff in there, and then they have to then apply to your facility.
Right. It's sad, but if you think about it, isn't it better that particular senior living is recognizing that they can't take care of that person for whatever reason than trying to and then doing something wrong. So I think if you are the consumer, the old Cy Sims educated consumer really rings true here. You've got to ask those questions, those hard questions, and know ahead of time, because as you said, having the person leave is not easy, but it's better that they know ahead of time at what point would mom or dad have to leave.
And are they asked to leave? Are they being given notice? How does that work?
Usually the clinical team talks with the family member and says, hey, listen, mom requires X, Y, and Z. We really can't do that properly here. Mom would have to leave. Usually they give about a 30-day notice. They'll tell the family member, you've got 30 days. And then the family member has to research and then find another community. I think that's one of the reasons why you want to make the right decision from the get-go. You don't want to have to do that, right?
Right. You know where the progression could get to.
Right.
And my guess is pricing isn't that much different, or is it significantly different?
Well, if you think about the Kensington, all of the care team, the employees, the team members we have to pay their salaries. So if you've got such a high number of staff in the building, then your prices are going to be higher. Right. But you get what you pay for, and I say this all the time.
Right.
If you're very independent, you don't need the Kensington.
Brenda, your information before we get off the air.
914-390-0080 or www.thekensingtonwhiteplains.com.
I hope all of you on the air enjoyed listening to Brenda as much as I did today. A tremendous resource, a great contact for all things relating to your seniors, the adults, the people that you love. So again, Mark Brownstein from Emerald Medicare. I look forward to seeing all of you next month. Any questions on Medicare, please don't hesitate to call or check out our website. We do seminars and webinars all the time. Be well. Thank you all.
Thank you.
Thank you, Brenda.